Hello friends, in this video I will be talking about the delegation for the Nclex exam. I have seen tons of videos in the YouTube, they talk about delegation, but there are some points they don't really talk about. So I'm gonna be highlighting on that. So please stay tuned. If you guys have any question, please feel free to ask. I would also request if there's any feedback I could receive at the end of the video, I would appreciate that. And if you haven't subscribed already, please do so. I would say encouragement is contagious. So if you encourage, so it works both way. I really hope that all of the everyone who's watching the video pass the Nclex exam without any hesitation and problem. So again, I want to encourage you. So let's talk about principles of delegation. So whenever you delegate something, so delegate means assigning responsibility when RNs are busy. So you have to know certain things, right? So first of all, need to know what you are going to be delegating. So the task, it should be the right task. For example, I know that I have to delegate the blood pressure monitoring to the nursing aide. Okay, the right circumstance. Okay, so right circumstance means it should be right condition. The person I'm delegating to should be willing to do that. So the right person, I know who I can delegate to. Right direction, I know where that person need to go, which room, which location, and right supervision. At the end of the day, I am the one who is responsible for the delegated task, even though I have assigned it to somebody else. Okay, so I am the one who is responsible. Okay, so RN will be responsible. Whenever you are asked this question, you know this. Okay, so no matter how many tasks you're delegated, if something goes wrong, they will question you first. Okay, it might also appear in your Nclex exam. Like for example, they'll give you a scenario and they'll say, okay, who is responsible at the end of the day? So it should be the RN. Okay, because you are the one who were given responsibility, you were the one who were supposed to be following the principles of delegation. Okay, so now we're going to be keeping that in our mind, and we're also going to be remembering that once, if we are delegating a task, who we are going to delegate to. Are we going to delegate to LPN, or we are going to delegate to healthcare aide or nursing aide? We usually call it in the Nclex language. Usually, when we work, for example, I'm talking about myself. When I'm working in a field, I'm working in a hospital, it's different. But for in the Nclex language, we need to remember this different things. Okay, so that's why I have created this amazing video to help you guys. Okay, so who is responsible for the task? Even though the task is delegated by the RN to LPN or nursing aide, but she's still responsible, as I said before. Okay, so she will be the one to follow all the rules. So she'll be the one responsible at the end of the day. Okay, so what she cannot delegate to other, very 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 important for the Nclex point of view. So if I'm RN, so what I cannot delegate to other nurses, I cannot delegate to nurses and nursing aides. I cannot delegate first of anything. So what does that mean? So that means I cannot delegate first assessment, first dressing change, first vital signs just after the operation. Okay, just when the person first come in. So first, whenever it comes the first initial, so that means you cannot do that, you cannot delegate that. Okay, so first vital signs before after surgery, no. First dressing change after surgery, no. So usually it's the doctor who does that. Very 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 important. Okay, usually it might appear in the exam, and you should know who does the first dressing change. Usually it's the doctor who did the dressing. Okay, she cannot delegate teaching of any kind. She is the one, RN is the one responsible for the teaching. She cannot delegate unstable patient who is having shock, who is having MI, who is having heart attack. But if they're stable, their vitals are okay, then she can delegate those patients to other LPNs or nursing aide. Okay, she cannot delegate IVs to LPNs. Very very important, you might don't get confused here. Okay, so she cannot delegate the IVs, okay, to the LPNs. She is the one, because it's a more complex procedure. Okay, so she should be the one taking care of that. So she should not delegate the IVs to LPNs. Okay, keep that in mind when you're answering the Nclex question, because the Nclex might try and trick you on this. Okay, so but there's some things she can delegate, so let's focus on that. LPN can do all the dressing changes. Okay, remember, first dressing change will be done by RN. So that's after the patient is stable, but the very first after the surgery will be done by the surgeon or the person who performed the surgery. Okay, so don't get confused here. LPN can administer all the meds except IVs and PICC lines, because these are more advanced procedures, so they shouldn't be doing that. Okay, LPN can monitor patient and report to RN. Even if it's LPN, UAP, anyone can monitor patient. If you see a patient having heart attack, okay, and what you're gonna do, of course you're gonna let your nurse know. Okay, so whoever sees something wrong, they have to report it to RN. So that's your job responsibility. And so what LPNs cannot do with IVs, very, very important, and you should be knowing this. Okay, they cannot start IVs. Okay, they cannot mix meds for IVs, they cannot hang IV meds, and they cannot document IV. They can document IV flows, because that's only, for example, the IV is running at 75 ml per hour, or the drip factor is this, because they have to chart at the end of the day, right, LPNs. So they can do that, but they cannot really do any IVs. Okay, can they maintain the IV flow? Yes, they can. Okay, let's see. RN told them, okay, can you set the drift factor at this and this rate? They can do that, but other than that, they really cannot do anything. Okay, so we have to keep that in our mind. So in an emergency, they can be assigned the task like cleaning the IV site, monitoring it. They can do that. Okay, and other tasks that LPNs cannot do. Do you think they can give blood? Okay, so giving blood is a very advanced procedure for the in the Nclex language, but these days LPNs are doing everything, so we are only reviewing it in the Nclex perspective. Okay, so they cannot give blood. Okay, because it needs more advanced management and care. Okay, so they cannot do care plan. So what does that mean? They cannot create a care plan, but then they can modify it. Okay, but for the Nclex language, no care plan for LPNs. Okay, so as I told you before, that they cannot do the teachings, right? They cannot teach patients, but can they reinforce teaching? For example, I have a patient who came to me and she's like, I have a headache, the RN told me to take this medication, should I take it? Of course, I'm gonna suggest them, if you're having headache, you should. Okay, so I can reinforce, I can tell them about, okay, you keep your dressing dry if the RN told you to. So I'm just implementing that. Okay, now let's talk about nursing aides. Okay, so they can chart about patient. Of course, everyone who works in the health field has to chart about patient, so there is no doubt in that. Okay, so they can apply barrier creams to patients. Barrier creams are the creams which we use in combination with the incontinent products. When you were in the clinical setting, you would have been aware about that. So yes, of course they can do that. They can check patients' vitals. Yes, they can. I know you must be very surprised about it, but they can check patients' vital in the Nclex and blood sugar. If you have one LPN, one RN working, and if you have one UAP, you will not assign the blood sugar check to LPN, because you know the UAP can do that. Okay, so they cannot do dressing change, which is sterile. Sometimes they can reinforce dressing, but they cannot do the sterile dressing change. Okay, so let's do a little practice here. There's LPN, RN, and nursing aide, and one has to do check the blood sugar. Who will do that? LPN, nursing aide, or the RN should go do it herself. I know in my mind I'm like, why don't you go do it, right? Sorry, just jokes apart. It has to be nursing aide. Okay, because the dressing change should be applied, should be sorry, getting a little mixed up here. So the checking the blood sugar should be assigned, checking the vitals for stable patients should be assigned to the nursing aide. Okay, so LPN can do anything else. Okay, while the stable patient is getting assessed by the by the UAP. And remember here what I said is assessed, so assessment should always be done by the RN, not nursing aide. But she can the nursing aide can check the vitals, and then they can check the blood pressure, like a temperature, pulse, because in these days blood pressure is Hello friends, in this video I will be talking about the delegation for the Nclex exam. I have seen tons of videos in the YouTube, they talk about delegation, but there are some points they don't really talk about. So I'm gonna be highlighting on that. So please stay tuned. If you guys have any question, please feel free